So this patient is coming in for an evaluation of a swollen right third toe. You can see it here. It's been progressing over the last 1 to 2 days. Differential diagnosis here would be, sort of gout, even though gout's more on the first metatarsophalangeal joint, or infection. The only issue is when you look at the back of this or underneath this, if I come around to this side, it looks pretty fluctuant. Looks like that's an ulcer that's there. So we're going to see if we can debride that out and then sort of see what we get there. This area underneath it looks pretty fluctuant. Fluctuant areas like that, like it's boggy. I'll show you once I'm not holding the actual camera. May not be much sensation over there. There's no freezing in place right now, and all I'm going to do is pare this down. If it's uncomfortable, obviously we're going to add some freezing in. We've talked before about how freezing may not work very well when it's actually infected, but we'll see what we get from there. So we're going to put some topical antiseptic on this, and you can see here when I push on it, like this is what I mean by boggy. See, that gives in a lot. There's just free fluid underneath it. So this may have to all be unroofed, or this just won't have a chance to settle down. Now this patient's not diabetic, but this is one of the things we worry about with this. So this is our number 15 blade. So essentially with this, I'm just going to pare down tissue because a lot of times there's a buildup of infection. That's not hurting at all?
Nope.
It really shouldn't, but if we get to a point where there's a pocket, then it'll drain for us. Now this part may just be callus, we'll see shortly, but I'd be suspicious. No pain there. Yeah. So you can see that, pus is pushing through. So this is going to come up all from up here. You can see when I put pressure on that. Is that hurting?
Nope.
Good. And this is why we need to be taking this down. So we got to get to there's infection all underneath here. You're okay there?
Yep.
And that was my suspicion. So this whole area is going to unroof. So this is all callus. And what's happened is it's formed a pocket underneath it. So these won't heal properly if you've done any wound care, unless we actually get that to clear. Yep, come on in. Dr. Jane's joining us. So he just had this pocket release through here, up through there. So this is what I thought it might be. So this is why essentially what we're gonna have to do is just take this down a little bit. Not hurting at all?
No. Well, minor, very minor.
Okay. Yeah, I'll show you once we get this finished here. So the biggest issue here is just if we can open this up so there's a chance to clear. But this whole pocket, no, there's actually none. Because typically these aren't too bad as long as we open them and allow them to drain. I always tell the patients if we need to add some, we'll add some in. But see, this whole area here is gonna have to come down. And my suspicion is, so part of this is we're gonna run some blood tests here as well, because we worry that there could be some sugar imbalances that are developing with this. Not hurting still?
No.
Does that hurt when I do that?
No, because when you're pressing on the top, that's what it's hurting worse.
Yeah.
I didn't feel anything in the back.
Yeah, and you can see here, this is all callus formation
Yeah,
here.
that will come off sometimes.
So Dr. Jane, I'd certainly debride this as best we can. Now we may do this in stages depending on how open it is. I certainly want to take that down a little bit more. So my suspicion is that this whole area underneath has to come out. So that area will be raw underneath. But this area here, I think that's communicating, it's going to have to unroof down through this area. Yeah, I think it is. You're okay?
Yeah, I know. I was just looking at the spinal from the other side. Push it.
So you can see how that tense up when I do that? See how that pulls? So this is all a big pocket underneath here that's got to come off. It's not hurting? Okay, I don't suspect. So typically when it's like this, the tissues don't hurt. They need to be debrided out. So this is what has to happen here. So you can see how this is just coming off. You can see how that's just an infected pocket underneath here. So if we don't debride this off, it won't heal properly. So we have to expose this down to normal tissue. Well, sometimes you won't when it's like this, when the infection swells like this. Now this area under here is usually a little bit more uncomfortable, but maybe not if there's a diabetic component. Does that hurt when I do that?
No, it's the outside.
Just through here you're feeling it?
On the top.
Yeah.
On the top, sorry.
So not too bad. So that should be debrided enough that we can now do dressings that will allow this to heal, and we'll have to put him on an antibiotic. So we'll stop filming at this point. We're gonna apply dressing. I'm not gonna be cleaning that much up other than I'm gonna irrigate this, and then we'll go from there.
अच्छा जी, आज हमारे पास एक आई थी, हमने रात कुछ खाना खाया था, फ्राइज़ वगैरह खाए थे, तो ये हमारे पास ना एक उसकी डील आई थी। ये पम्फलेट आया था, वो कह रहा था कि आप हमारे से परचेज़ करें चीज़ें। तो ये बहुत ही कमाल के ओनर हैं, रेस्टोरेंट है, बहुत ही कमाल के रेस्टोरेंट है। तो इनकी मैंने फ़्राइज़ खाए हैं, बहुत ही टेस्ट था इनकी फ़्राइज़ के अंदर। और ये इनका बहुत ही अच्छा इनका वो है मोल्टन लावा जो है वो विद आइसक्रीम, बहुत ही कमाल की चीज़ें ये बनाते हैं ये लोग। ये आप लोग भी देख सकते हैं, ये बहुत ही कमाल की चीज़ें बनाते हैं जी। आप लोगों ने अगर इसको कुछ ऑर्डर करना हो तो आप लोग इससे ऑर्डर कर सकते हैं। यहाँ से हम लोग अपना खाना मंगवाते हैं और मोस्टली मैं यहाँ से शॉपिंग करता हूँ, परचेजिंग करता हूँ, खाना खाता हूँ, सारा कुछ करता हूँ जी। और इनका बहुत ही अच्छा टेस्ट है जी। आप लोग इसको एंजॉय करें जी, इसको बाय करें जी आप, ठीक है। मैं आप लोगों को बताऊँगा कि कहाँ से बाय करना है। और इनका टेस्ट बहुत अच्छा है जी, बहुत ही कमाल का टेस्ट है जी इसका। आप लोग इसको एंजॉय करें जी, आप इसका बाय करें जी, आप इसको सारा कुछ करें जी। थैंक यू।